CBS 8 is a proud partner of Go Red for Women, the initiative with the American Heart Association, bringing awareness of the issue of cardiovascular disease in women. On this Valentine's Day, Go Red wants you to be the beat and learn CPR. And now, you really only need to know hands-only CPR. Maureen O'Connor, best known as Mo, she's a program manager for the City of San Diego Fire Rescue Department. She's joining us here along with Fire Captain Alma Lowry with just how important this is. Thank you, ladies, both for coming in on this Valentine's Day. We appreciate your time.
Thank you for having us.
Well, let me start with you. I don't think we realize just how important it is to know CPR. And from what we were chatting about in the green room, people are a little reluctant to do it on women.
They are reluctant to do it on women, and there's disparity there. For obvious reasons, modesty reasons. People don't necessarily want to bare the chest and follow the proper procedures to deliver the best CPR therapy on a bare chest. But it's very important. Baring the chest allows for good landmarks, good therapy for the patient, and also prepares the chest for AED use.
Well, let's just get started, shall we? We brought in some mannequins here. So Alma is going to show me how to do it on one side, and you're going to walk us through on the other side. So I'll change places with you.
Excellent.
These are our mannequins. Captain Lowry, as far as we were just mentioning baring the chest, does that mean if we came upon a stranger, would we unbutton their blouse or undo the zipper?
Yes, you're going to do the best you can to bare that chest to make sure that you can see that landmark of that sternum.
And that's what we're looking for.
And that sternum is what you're looking for that heel of that hand.
Okay, so Mo, show us what to do. We come across somebody, before we just jump in and start undoing a blouse, we probably want to make sure that they are indeed needing CPR.
First things first, right. We want to look for anybody who's laying on the ground or slouched over a steering wheel at a desk, just in an unusual fashion, and check them. Hey, are you okay? You don't want to give that any more than 10 seconds. You're going to check. Hey, are you okay? No response, no breathing. Alma, go call 911. Heather, go get the AED. While they're off doing that, we're going to bare the chest as we have, right across the nipple line on all people, or underneath the armpit for some. You want to put the heel of one hand. This heel of your hand fits perfectly over what we call medically the sternum bone. That is correct. And many of you may know it as the breastbone. Intertwining the fingers, we can pop back that heel of our hand, and we just want to put our whole upper body weight into that person, pressing 1/3 depth of chest. A little over 2 inches for adults, little under 2 inches for children. Of course, it, depending on the person and their size, we want to press at least 100 beats per minute.
100 beats per minute.
At least 100 beats per minute. Using this technique, we're providing the best therapy, and it won't wear us out because we're only rocking from our hips.
Can I ask you a question? What if I hear like crunching? Like maybe there's bone material there that would that?
Good point.
Should I stop at that point?
So another thing is that focus, the sternum bone, is where we want to focus on pressing. That sternum bone is connected by the ribs. It sits in front of the heart, and it's connected by cartilage. So sometimes when you hear crackling, when you're doing compressions, it's really cartilage breaking up, kind of like cracking knuckles.
Okay, like so don't panic. And you're not necessarily putting your hands on top of somebody's breast if it's a woman. It's right in between. And we keep doing 100 beats per minute.
At least,
until the paramedics arrive.
Correct. And it's so important because every minute that passes without CPR, without something being done for that person, they lose a 10% chance of survival. So if somebody just stands back and waits for the fire department to come, that person is probably not going to survive, even though our arrival rates get better every day. It's just so important to immediately start CPR and don't give up.
We're almost out of time, but I want to bring in Captain Lowry really quick. What do we do when you arrive on scene? Do I keep going? Do I say, okay, my job here is done? How can I best support the medics who show up?
So that's a really great question. You're going to be guided by what our dispatchers are giving you, the information. They're going to be walking you through the CPR process before we arrive. When I arrive or a crews arrive, I'm going to let you know you're doing a great job or a little bit faster. Keep going and doing what you're doing. We're going to get all of our things set up. The rest of the crew is going to be coming in and somebody will be taking over for you.
Okay, fantastic. Good
Yeah.
to know. So don't just stop as soon as you see that
No,
fire truck.
right.
Well, I know we could spend a lot more time talking about this because it really is so important, especially when we realize that cardiovascular is still the leading cause of death for women in the United States. I do want to let you know that we are having our Go Red for Women luncheon coming up here on February 24th. That's next Friday. And for more information on that, just go to the website right there at the bottom of your screen. Ladies, thank you so much. Thank you for what
Thank
you're
you
doing
very much,
every day
Heather.
here in San Diego, saving
Go
lives.
save a
Appreciate
life.
your time. All right, ladies, thanks. Carla.
Thank you.